Science for Global Health. I'm your host, Hisra Ahmed, and today I'm honored to speak with Dr. Mohammed Iqbal, who is joining us from Manchester. Dr. Iqbal is a consultant neuro-otologist at NHS Salford Royal Foundation Trust and the University of Manchester. Also founder and trustee of APS UK Foundation. With over 25 excellent awards, including the Lloyd's TSB Excellence Healthcare Award, the Lifetime Humanitarian Award, and the COVID Hero Award, Dr. Iqbal's work has reached and touched many lives far beyond the clinic. His commitment to patient welfare and humanitarian service has earned him national and international recognition. Welcome, Dr. Iqbal.
Thank you, Hijra.
So, Dr. Iqbal, you've received numerous awards for both clinical expertise and humanitarian work. Could you share the journey from specializing in neurotology to APS UK Foundation?
Hijra, this journey goes long way back to my childhood. I was born in a very poor family. 2 meals a day were bonus. Education was very difficult, but secondary school was sponsored by somebody. And then um, I wanted to be someone professional, but not necessarily a doctor. But my mother would stand just outside the medical school and would pray that, oh Lord, my son should become a doctor one day. And that wish was such an impact on my heart that I worked hard during my A levels, and then it was a journey in medical school with gold medals and silver medals. And then I passed my FCPS Part 1 in Pakistan and came here with a hole in my shoe with no money to buy a shoe. And I passed my FRCS Part 1 and then PLAB exam, and then I started working. And I found that, oh, this is a very different world, and I was enjoying every day of my life here. Then I realized, no, all is not what I should receive. There has to be some difference. Anyway, that is a part to the charity, which I will come later. I have worked extremely hard in my professional capacity, and then I became the consultant neuro-otologist in 1998 at Salford Royal Foundation Trust Teaching Hospital. It was not easy, it was difficult, but then there is nothing which is easy. One has to work really hard to achieve or to gain something. Then I realized in 2012, when I was the chair of the doctor's body, APPS UK, that I am part of a political organization or social organization. There is no welfare element to this. And I wanted to give back to community, to give back to disadvantaged people globally and particularly in Pakistan. So I started APPS UK Foundation. There are 31 projects. I can't even remember the names of the project, but I'll try to remember. Fruit cart project for the beggars to earn with dignity, wheelchair for the patients who are not mobile and who cannot be operated, prosthetic lower limb, prosthetic upper limb, free cataract operation, free mobile healthcare unit, wedding of the orphan girls, bridal dresses, um, and Labag project, in which we provide 1 month ration during the month of Ramadan. 112 Palestinian children and 450 Pakistani children being sponsored for education. And this is not just restricted to Pakistan. We have helped people in India, Bangladesh, Morocco, Libya, Syria, Lebanon. So things have spread because when you build a team, the team always flourishes with good people. And here we are with all this good work.
Thank you so much, Dr. Iqbal. You're doing some amazing and fantastic work with APS UK Foundation. Now, looking ahead, what is your broader vision for the healthcare industry, both in the UK and globally?
You see, healthcare industry is facing challenges. The challenges are lack of experienced consultants, budget shortages, and also um, there isn't any will to really adapt or adopt the artificial intelligence, which is becoming a hallmark of success. As you know that AI itself can give us 78 to 90% correct diagnosis. And this is an amazing, amazing result because not every consultant can give us 100% diagnosis. So, with using AI and using the brain of an experienced consultant, we can help the patients a lot better. If you see the progress in UK, UK is third in ranking in global healthcare. There are 5,600 life science companies, and there are top 10, 25 global pharmaceutical companies based in the UK. UK has a wonderful system of NHS, which has been established over a long period of time, and it is very well coordinated system with the primary care, secondary care, and the tertiary care. Now, what we have to understand that with the growing demand, there is going to be pressure anywhere, not only in the UK, but anywhere in the world. And this pressure has to be addressed. The pressure has to be addressed by budget, which is unfortunately under pressure. So if you can't afford to increase the budget, you can't afford to pay for the new staff or for the good quality staff. And secondly, you cannot really um, spread the system to have the modern technology along with it. So there are pressures, there are challenges, but still we are doing very well.
Thank you so much, Dr. Iqbal. You have touched upon some of the challenges that we face in the healthcare, and not just, as you said, in the UK, but globally as well. That was actually my next question was going to be about the challenges. So, what, in your experience, is the biggest challenge? I know you touched upon AI, but what is AI the biggest challenge now in driving innovation in healthcare? Or are there other challenges as well? And how can we overcome them?
I think the biggest challenge is the growing demand. The demand is growing much faster uh, than the resources we have to address this demand. The demand is growing in the primary care sector. The demand is growing in the secondary care sector and the tertiary care sector. The tertiary care sector is not affected as much as the primary and secondary care. So one is population is increasing, the number of people who are coming to this country, the number of people who needs healthcare service, it's much more than what we were addressing 5 years ago or 10 years ago. But we haven't expanded our NHS system to that particular need which is required, and this disproportionate demand and provision ratio is causing a lot of problem. So, for example, if you don't have the enough budget in the NHS, then you can't really hire enough porter, enough nurses, enough doctors, and that is going to affect the service provision. Secondly, we are using outdated softwares, which is affecting our performance. We really need up-to-date softwares. We also need to shift from the hospital-based service to primary care-based service or community-based service. I must say that community-based service helps the patient to be seen closer to their home, not to travel long distances, not to come to the hospital. So hospital remain the hub for the complex cases. Third is that we need to develop the virtual uh, clinics. For example, if you look at my dizziness and balance clinic, 50% of my cases are virtual. So, and I do this very successfully with the positive outcome, with the excellent feedback. So it's not that we cannot offer this service for the patient who do not have to leave their home. We can offer them with success, with good feedback, with good outcome. And we have to bring some cases after virtual discussion, after telephone or video consultation, we have to bring some cases, but then these are some cases. For example, if there are 100 cases and if I see 50 cases virtually, and if I have to bring 10 cases to the hospital, then at least I have uh, fulfill the demand of the 40% without coming to the hospital. Now, this is going to be very important. This is not only required for the doctors but also for the nurses. There are and therapists. There are a lot of therapies which can be addressed by virtual interactions, and I think that we should be seriously looking to shift our care to virtual care.
Thank you so much, Dr. Iqbal. And it worked during the COVID time, so there is no reason why it cannot work now.
It works really nicely. I tell you, you have to choose your patient. You can't really select all patients to be seen virtually. You have to read the triage referral letters. You have to triage them accordingly. So when I get my patients, I triage them into virtual consultation platform or face to face, and some virtual will come to face later on, and this works so nicely that the patients are happy. Old people, they really need transport, ambulance, they don't need to come. And there is help available at home. Somebody is helping them. For example, people who don't speak English, there is some help available at home who can help them to understand the question. And sometimes the doctors are multilingual, which is very good, for them.
Thank you, Dr. Iqbal. My final question is on global health. And as per the theme of the podcast, you have 60 seconds to respond. What is one practical step that clinicians worldwide can take to improve access to specialist care in, say, low resource settings? Your time starts now.
In my personal opinion, the telemedicine is the best thing one can adopt. Not only telemedicine to address the needs of the patient, but also of the carers, but also of the people who are learning professional development. Telemedicine has not been utilized as much as we should have done that, and it must be done as soon as possible to a wider scale. It is least um, it is not understood practically by those who don't practice telemedicine. You have to practice telemedicine to understand how successful it is in terms of outcome and in terms of support and care you provide without patient leaving their home.
Thank you so much, Dr. Iqbal, for sharing your thoughts and expertise with our viewers today.
Thank you, Fiza. Really appreciate it.